Hi everyone, back to channel. Now we are going to see Schistosoma Japonicum. It is also known as the Oriental blood fluke. So the six species which are infecting in humans are Japonicum, Hematobium, Mansoni, Intercalatum, Mekongi and Malayensis. Here you can see them. But now let us learn about Japonicum, which is very important, causing the schistosomiasis. And the disease mainly caused by this Japonicum is also known as Katayama disease. And this schistosomiasis is caused by schistosoma species infection, and it's major human health problem in many parts of developing world. It's endemic mainly in African, Latin American, Asia, including 76 endemic countries or areas. So more than 600 million people in the endemic areas are risk of this schistosomiasis, and the number of infected individuals worldwide is nearly 200 millions. So it is a major disease, this is causing disease to this many people, so we need to be careful and know about this, what kind of disease, what it is causing. So introduction, this Schistosoma japonicum, most pathogenic of all human schistosoma species, and it occurs in the parts of China, Japan, Philippines, Indonesia. So you can guess it because the name Japonicum, like in Japan, China, Philippines, so those neighboring countries, and it has been existing at least 2100 years in China because of its calcified eggs were found in mummies of Hunan and Hubei. So what they are saying, in China especially, their mummies, these are present mainly because China is endemic area for this also. And next we need to see all this morphology, life cycle, pathogens, diagnosis, epidemiology and prevention and control. So first let us see the adult worm. So this is a microscopic structure. You can see how the adult worm looks like. So these are the adult worms. Here you can see, actually this is dioecious animals, that is both sexes are separate, that is male and female. So you can see this slender, this is female and this is male, this fat one is male. So these are together when during copulation phase, you can see. So this is a female and this is a male. And adult worm. So the first one is S, that is oral sucker, and A, this is the ventral sucker, and T is the testis in the male, and U is the uterus in the female. You can see uterus, so this slender one is female, so it has uterus, and also O, ovary, you can see ovary of female, and gynecophoral canal, you can see C, gynecophoral canal, it is present in the female. And next, coming to the morphology, adult worm have elongate slender bodies, sexual dimorphism as I said, and the oral sucker is at the anterior end and the ventral sucker is near. Yes, you can see this is the oral sucker and this is the ventral sucker. And next, coming to adult worm males measure about 10 to 22 meters in length and 0.055 millimeter in breadth. You can see they are like somewhat fat structures. Total of 7 testes are present. This is important. It contains total 7 testes by side in a single row, side by side in a single row in a male fluke. You can see like this, side by side, this is testes, so they lie like this, 7 testes side by side in a single row. And the males have a deep ventral groove known as gynecophoral canal. So male have a gynecophoral canal, which is a deep ventral groove. And coming to female, the female is so slender, you can see 20 to 25 millimeters in length, 0.3 mm only in breadth, and the ovary is at the middle of the body. So you can see this is the ovary, so it is in the middle of the body, and uterus is long, containing up to 300 eggs, average 50 eggs, so it averages 50 eggs. And the vitellera in the lateral fields, posterior quarter of the body. So this is the posterior quarter of the, this is called as vitellaria. And next, coming to egg. So egg of course is formed by female. So what egg, what is about that? It is 89 into 67 millimeter. Its shape is oval, oval. Color light yellowish color, and structure you can see without operculum, no operculum, and only thin shells, and possess a lateral spine. So this is a lateral spine, you can see. So this is a special feature of this egg. And a miracidium in a mature egg. This is a miracidium in a mature egg, only in mature egg. In immature egg, no miracidium. And Cercaria is an infective form, consists of a body, a tail and a pair of furcae. So the body is 100 to 150 mm long, one tail is 140 to 160 mm long. Furca are 50 to 30 μm long, and the oral sucker is comparatively large and the ventral sucker is smaller. So this is the oral sucker bigger, but the ventral sucker you can see in the middle it's smaller. And coming to cercilia, you can see this is in the microscopic structure, it is the infective form. So let us see the life cycle. It includes the adult worm, that is male and female, egg, and miracidium. Miracidium is present only in mature egg, and sporocyst, mother and daughter sporocysts are present, cercilia and schistosoma. So what is this we are going to see? It is a complete in the following host: a definitive host, intermediate host. Who is the definitive? Of course, man, domestic animals like pigs, cattle, buffaloes, and wild animals. And intermediate host is Oncomelania, that is Oncomelania species of snails, you can see here. And next, adult worm and deposition. So adult worms live in the veins of a small intestine, that is especially in the inferior mesenteric veins of small intestine, in the definitive host, that is maybe in man, pigs, or other animals, and where mature female is often found in the gynecophoral canal of male worm. So gynecophoral canal, if you remember, it is present in male. So in that canal actually a female always lies, so it always lies with the male. And here you can see the life cycles. Let us understand this. First you can see the eggs are coming out from the S. japonicum egg, you can see with the lateral body. So this egg, it hatches out and releases the miracidia. These miracidia enter into the snail tissue. So after entering into snail tissue, it comes out as sporocyst in snail. By successive 2 generations, it undergoes 2 generations and forms a sporocyst. So this sporocyst enters the water nearby, and cercilia are released by the snail into water and free swimming. So it is released into the water like somewhat dirty water. So whenever the man goes there, through his skin, especially through his legs or hands, because he put them in water, so this cercilia gets attached to it and it penetrates to our skin and enters into body. So after entering into the body, of course, if you think for example from the leg it enters, so from leg like this it comes up and goes into the lymphatics and drains into the right atrium. From right atrium it goes to right ventricle, from there to the pulmonary branches and reaching the lungs, so and causing lungs abscesses there. And from lungs again through pulmonary vein it enters into a left atrium and going to left ventricle, and from there it goes to the systemic circulation. So from the systemic circulation it enters into various places, especially it enters into intestine first. Intestine is the main area, and after entering into the intestine, from there it may also by the portal vein it also enters into the liver. So liver is the second. So first most infective form is intestine in humans, and next the liver. So let us see here, this is a lose tail during penetration and becomes schistosomulae, and next through circulation, mainly by venous circulation, it enters into right atrium, left atrium, and by systemic circulation into intestine. So migrate to portal blood in liver and mature into adults. So in the liver they copulate. So their parent adult worms migrate to mesenteric venules or ball or rectum laying eggs of circulatory to liver, shedding stools. So what happens from there, it goes to the intestine and they form eggs and they get lost from the human in the form of eggs, fecus. So venous plexus of the bladder, and again this enters into S. hematobium in urine. These are some species, hematoburium is present mainly in urine, and S. japonicum and S. mansoni are mainly present in fecus. Of course hematobium is also found in fecus. So like this, from fecus again the man, because of poor sanitation habits, if fecus is thrown into water or any other place, again this life cycle continues. So adult worms live in the veins of small, so this one we completed. And next, after mating, the females are laying eggs. The worm work their way upstream into smaller veins. A female is reporting 300 to 3000 eggs per female daily. So masses of eggs cause pressure on thin venule walls, which are weakened by secretions from histolytic glands of miracidia with eggs. So the wall rupture and the eggs penetrate into the intestinal walls, thus pass the outside by the feces. So actually how it is entering into our feces? Because of their histolytic enzymes rupturing our wall and entering into our feces. So life cycle will understand adult worm and its deposition. You can see adult worms live in the inferior mesenteric, how they are present in our inferior mesenteric vein, and hatching of miracidium in fresh water. So this part, how they are hatching, you can see Because of this only it is continuing its life cycle. And hatching of miracidium in freshwater. After mature eggs with miracidium enter the water, the miracidium will be hatched out. So this is. And development in snail, how it takes place in snail. So this process we'll understand now. The release the miracidia can live for a few hours. So when meeting snail Onchalomelia hupensis, the miracidia penetrate the snail foot first or body with the aid of histolytic gland again. With the snail, the cilia are shed and the miracidia becomes sporocyst. So in the snail it converts into sporocyst. And next, penetration of host, how again it enters into host. So in water infected snails with Serraseria release mature Serraseria. So this mature Serraseria is infective state. This is important. So they are active swimmers but may have motionless from the surface of water. So the lifespan of this is about 1 to 3 days. So whenever between those 1 to 3 days, if the man goes to that place, then he will surely get attacked. And penetration of host occur within 48 hours. So complete penetration into host takes place up to 48 hours. And next, when contacting with skin at a host, Serraseria attach skin by suckers mainly and release enzymes from the glands at the anterior ends and then enter the skin, combining with muscular movements of parasite body. In this process, the tail is cast off. So entry time is about 3 to 7 minutes. So by 3 to 7 minutes it enters into our body. And as here you can see, migration and inhabiting. So when Serraseria penetrate, then what it does, it becomes a schistosomules. This schistosomule leaves the skin and develops into young worms. And next, the young worm enter into lymphatic or blood vessels. Then heart, circulatory system reaches mesenteric artery, capillaries grow and migrate into superior mesenteric venules. So first they enter into any lymphatic or blood vessels and finally migrate into superior mesenteric venules. And next, here copulation takes place and females enters the gynecophoral canals of males and there they lay eggs. So about 44 days elapses from time of penetration by Serraseria to the oviposition. A month late the eggs appears in the feces. So it takes about a month late also to appear in the fecus. And the lifespan of adult worms is usually 4.5 years. So it is a long lifetime. And you can see the life cycle here, the route of migration of this Japonicum from number 1. So first from the Serraseria, here they gave example of lymphatic vessel. It enters into the lymph and from there here you can see the number 3 where it is entering into left heart, if you remember that process. And next 4 it is entering into systemic circulation and 5 you can see in the systemic circulation path. 6 it is entering into the intestine and 7 from the portal vein into the liver and 7 and 8 also in lungs. From liver also it may enter into lungs because of their connection. And next 9 into liver and 10 finally into fecus. So this is a life cycle route. And next coming here you can see the life cycle process. First adult egg, water, fecus, liver, bowel wall, miracidium, mother sporocyst, daughter sporocyst, Serraseria, Serraseria, penetrate skin, schistosomule. So this process continues. Here the water snail is the main important one. So summary, adult worm live in the mesenteric vein of human and other animals. So intermediate host is Onchomelania species, infective stage is Serraseria, infective route is skin, and infective way is to touch the water with Serraseria, and migration passage of schistosomula through heart, lung to inferior mesenteric artery, and life of adult is 4.5 years. So what is pathogenesis? This Serraseria schistosomula adult worm eggs can cause pathological changes in the host, not only Serraseria but also Schistosoma adult worms. So what they do? Serraseria first, it penetrates into skin causing scleroserial dermatitis. You can see how it is forming. And schistosomula, these organs pass through schistosomula such as lung, appear vasculitis, lymphangitis, hemorrhages, giant cell reaction, eosinophilic infiltration. You will see eosinophilia because at the site of infection they come more. So you can see eosinophilia. And the characteristic clinical features include cough, fever, bloody cough, eosinophilus, etc. Because it is entering into lung and causing lesions there, so blood leaks out and all this takes place. So you can see schistosomula in the lungs, how the abscess is formed here. And adult worms, you can see, live in the inferior mesenteric vein, and the metabolic products and toxins products discharged by these adult worms stimulate the immune system, causing the hypersensitivity reaction, especially type 3, that is causing endangiitis, periangiitis, anemia, eosinophilia, because of adult worms. And egg, the soluble egg antigen, that is SCA, secreted by the miracidium in eggs, causing the type 4 hypersensitivity. So you remember, egg is causing type 4 hypersensitivity and adult worms are causing type 3 hypersensitivity reactions, and from the eosinophilic abscess then to granuloma, fibrosis, finally in the tissue of liver and the wall of canal. So because of all this, the liver and the spleen actually they enlarge and causing megalies of spleen and lung, liver. So this is the most important cause of schistosomiasis. And egg deposition site is mainly liver and the wall of canal. So you can see in the liver how many, and also wall of canal you can see how that spots are being seen. And also egg deposition in the liver wall of colon. So even in the colon the eggs get deposited, and in eggs here you can see these are the eosinophils and this is the egg. So egg granuloma in the liver, granuloma is an inflammatory reaction in which both the invader and also our body's inflammatory cells are present there. This is known as granuloma. So egg was surrounded by the eosinophils, you can see, and egg granuloma. And this is all the pictures of egg granuloma in different stains and different sites. So damage by eggs in the tissue, liver and intestine, and inflammatory granuloma forms with epithelial, giant, plasma and eosinophil cells, and also fibroblasts. This is known as Heopley reaction. So you need to remember this. And what would be the clinical manifestations? This schistosomiasis can be divided into 3 phases: acute, chronic, late. So acute stage, the serratia dermatitis, that is local pruritus, erythema. So this is not so dangerous, just only those things. And acute stage also includes fever, chill, ache, gastrointestinal complaints, hepatomegaly, so the stomach, abdomen is enlarged, you can see splenomegaly, eosinophilia. Acute causes usually observed in persons entering endemic area for the first time, because it's severe more for the first time. And chronic stage, 90% of these persons are chronic cases of schistosomiasis. So the general symptoms: weakness, fatigue, abdominal pain, irregular bowel movements, and blood in stool, diarrhea, hepatosplenomegaly, anemia, emaciation. And late stage, advanced case has 3 types, that is splenomegaly, Laspin, ascites, and dwarfism. Even dwarfism is also because of this. And hepatosplenomegaly, portal hypertension, abdominal collateral vein dilation, and esophageal varices. So you can see how this has gone. And dwarfism also you can see here how the child is so short. So this is all about because of this. The abdominal collateral vein varices, varicose veins like things which takes place in our legs, this also takes place in abdomen, then it is known as abdominal collateral vein varices. And pathogens include ectopic lesions, like more commonly invade central nervous system and other organs too, so then do other schistosomes. So ectopic means going other than the main causing site. So this can cause cerebral schistosomiasis and also pulmonary schistosomiasis. So diagnosis, we can find it by X or miracidium. So direct smears, we can 35 to 48 days of infection with serratia. X can be found in the feces by direct smears. The method is simple but it's low sensitive. So there are also some indirect methods like portal venography, USG, computed tomography are helpful in indirect diagnosis of the disease. So you can see finding eggs or hatching of miracidium as an index of viable egg, and also Cato-Cat's method, which is a quantitative examination but the sensitivity is low in likely infection. And parasitological examination you can do by rectal biopsy. So method is highly sensitive clinical diagnostic, but this is invasive procedure is neither simple nor convenient for population based surveys. And you can see the immunodiagnosis is by intradermal test, because those patches all those are formed, so we can find through that. And also immunodiagnosis, it can be antibiotic detection or circovatal precipitin test, that is COPT. So here the antigens are viable X, specimen sera, sensitivity 97.3, false positive rate is 3.1. So even we can do this. And immunodiagnosis, antibody detection, indirect hemoagglutination test, and also SCS, soluble egg antigen, sera, So here the sensitivity is up to 100% and false positive is only 2%. So immunodiagnosis also by enzyme linked immunosorbent, that is ELISA. And if it is adult worm antigen, then we can do a C or AWA, and specimen is SIRA. So this you can see all those. And antigen detection can be done by dot ELISA, sandwich ELISA, and monoclonal antibody for antibodies. Sensitivity you can see. And the negative rate of a half year after treatment was still 50%. When coming to ultrasound by hepatomegaly and splenomegaly, you can find them in the ultrasound examination. And epidemiology mainly found in China, Japan, Philippines, Indonesia, and in Japan it has control eliminated since 1978. So you can see the geographical distributions, of course, in Japan, Philippines, China. So types of endemic areas, there are 3 types. That is water-net regions of plain, marshy regions, mountains, and hilly regions. Of course, those are the places. So water-net regions of a plain, here you can see, and the marshy regions, so hilly regions, so all this. And epidemic features main reserve of infection. This is a zoonosis, that is infected livestock are important reservoirs of infection beside infected persons, infected cattle, water, buffaloes, pigs. So zoonosis is animal related disease, so even these are important because they may also affect us, like buffaloes, cattle, and pigs. And way to infection is by contacting infected water with serraceae. Ways to contacting infested wood in 3 types, that is contamination with boating, fishing, washing clothes, bathing, etc. And way of infection you can see in this way, if you put our barefoot in a water, like that. And susceptible population, human susceptible host, lower age people. Transmission April to October is the main season. And natural factors, environment, temperature, level of water, natural soil, vegetation. Social factors, economic level, sanitary condition, medical care, ways to produce, local costumes, etc. And we use the Prezi-Quantal mostly for this. And can see prevention and control by higher venture, low toxicity, so single dose can be given for chronic cases or mass treatment. In China we do this, and 60 grams in 2 divided doses, give with a 4-hour interval on the same day, and 120 mg in 4 to 6 days for acute cases. So the last one is control and measure. So to treat patients and livestock, chemotherapy, master selective treatment can be done. To control snail, environmental modification, molliciding, environmental modification you can see, and molliciding to cut off the moles, and to reduce the frequency of water contacting, like this, be careful. And control measurements to prevent by drug Etriminicin, Etriminisa annua, erythrometer, erythronate. So this also can be given for controlling, not for treatment. So this is all about today's class. And we need to remember in liver it also causes periportal cirrhosis too. So we need to remember because it gets infiltrated into our liver cells, causing cirrhosis. And also, so this is all about. So in adult and humans, it attacks mainly intrahepatic portion of portal venous system, mesenteric veins draining ileocecal region, and rectal, that is hemorrhoidal plexus of veins. So that is one more key point. And this is all about Schistosoma Japonicum.